Welcome, everybody. My name is Bill Gilbert. I'm the Regional Medical Director for Women's Service here in Sutter Health Sac Sierra region, and we have some exciting news today. A project that we've been working on for several years is being published in the premier journal in the next month's Obstetrics and Gynecology. And the Sutter system has been very much involved with that in working very closely with the March of Dimes. We've been able to make significant improvements in how we treat our pregnant mothers in an effort to improve their outcomes and to improve their babies' outcomes. So what I'm going to do now is going to introduce Leslie Kaloweski. I'm sorry, I've known her for a long time, but she's here she's the Assistant Director, Associate State Director for the March of Dimes for the California chapter, and she's really been leading this push with the five-state project for the last couple of years. Leslie.
Thank you. So we're very excited to be here, and this has been a long time coming, and we've held our breath and we waited for this day to come. We've been wanting to launch our results, and so thank you for your patience as we've all sat quiet and sat on our numbers. So, a study published today in Obstetrics and Gynecology shows that multi-state hospital-based quality improvement programs, including those piloted in California, can be remarkably effective at reducing early elective deliveries of babies. Today, we are proud to announce the study results. The rate of early-term inductions and cesarean sections without a medical reason prior to 39 weeks in a group of 25 participating pilot hospitals significantly decreased from 27.8% to 4.8% during the one-year project period. This is an 83% decline. Congratulations. Inducing a woman without a medical indication before she reaches at least 39 weeks of pregnancy can be dangerous. We know the final weeks of pregnancy are crucial to a baby's health because many vital organs, including the brain and lungs, are still developing. Ensuring babies are born at full term is a key component of the March of Dimes work to ensure all babies have a healthy start at life. A group of hospitals, including 6 in California, piloted the toolkit called Elimination of Non-Medically Indicated Deliveries Before 39 Weeks Gestational Age, a guide to change practices in early deliveries. The toolkit was developed here in California, and it was a partnership between the March of Dimes, the California Maternal Quality Care Collaborative, and the California Department of Public Health. The toolkit gives hospitals the tools and guidelines to reduce deliveries that are not medically necessary, and the education materials to teach pregnant women and providers about the importance of the final weeks of pregnancy, because our goal is to eliminate elective deliveries prior to 39 weeks. The 6 hospitals in California, including Sutter Medical Center Sacramento and Sutter Roseville Medical Center, are among the first in the nation to join a multi-state collaborative comprised of state health departments, academic health centers, and March of Dimes chapters from the 5 most populous states in the country. In California, more than 500,000 babies are born each year, accounting for nearly 13% of all births in the United States. Together with Florida, Illinois, New York, Texas, these 5 states account for an estimated 38% of all births in the U.S. 38%, just 5 states. So what can we do together to have a significant impact? Today, we celebrate the publishing of the pilot program results in the Journal of Obstetrics and Gynecology. This was our first project of the Big 5, and indeed we were successful. Reducing unnecessary early deliveries to less than 5% means that more babies stayed in the womb longer, which is important for their growth and development. These hospitals demonstrated that together we can make real changes for the health of moms and babies. Sutter Health has adopted this program on a larger scale and has tremendous results, giving more babies the healthiest start in life possible. We applaud and congratulate Sutter Health for their leadership and dedication, and for this and many other important maternal and child health programs. Thank you for your leadership in improving the health of moms and babies. Your work has made a difference not only for your patients locally, but it has impacted the practice of hospitals across the nation. Thank you.
Good afternoon. I'm Lori Gregg. I'm your Medical Director of Patient Safety and Quality Improvement for Women's Services, and I'm here to give you all a hand for the successes that were created here at our medical center. When Sutter, Sacramento was approached in 2010 to become one of the pilot hospitals, we were a little frightened, but we were really actually very excited to be part of the Multi-State Quality Initiative and to partner with the March of Dimes to further reduce our non-medically indicated deliveries less than 39 weeks. Since 1979, the American College of Obstetricians and Gynecologists policy has advocated having a healthy pregnancy stay in the womb for greater than 39 weeks. Just recently, the March of Dimes and the California Maternal Quality Care Collaborative and the California Department of Public Health created a toolkit which collected the accumulating data showing the benefits and also how a hospital can implement a policy to keep these babies in the womb until 39 weeks. Any hospital that's dedicated to this initiative does have a lot of work ahead of them, but that toolkit eases the work, allows it to run smoothly, and really sets it on a good direction. Over the past 2 years, Sutter Medical Center in Sacramento has decreased our rate, and here's our numbers, from 15% in 2010 down to 5% in 2011. Over the course of 2012, our rate has averaged 2%, and this rate has continued into 2013. So that's remarkable, from 15% down to 2%.
Surge plan level 6, emergency department on surge plan level 6.
Physicians, staff, hospital administration, and patients are to be commended for working together to achieve this success. The physicians for their dedication to accurate gestational age dating and diagnosis, the staff for adherence to policy and collection of all that data, the hospital administration for their support and attention to this project, and the patients for understanding the benefits of waiting and the willingness to endure the last weeks and days of their pregnancies. We also want to recognize and express our gratitude to the March of Dimes, who really facilitated the 25 hospitals sharing best practices. The Sutter Health System's dedication to the concept of we plus you really holds to multiple aspects of this initiative. Thank you for allowing us to share our success with you all today. And I'd now like to introduce Sue Chambers, who's the Director for Women's and Children's Services at Sutter Roseville.
Welcome, everybody. As Dr. Gregg said, I'm Sue Chambers from Sutter Roseville. I had the opportunity back in the mid-'80s to work with the March of Dimes on a preterm birth prevention program. And so when the grant proposal came out, asking all hospitals in the state of California who did deliveries if they were interested in participating and applying for the grant, I was very intrigued and interested and excited to be involved with the March of Dimes again. Talked to our obstetricians, talked to our labor and delivery staff and administration, and got great buy-in from all of them to go ahead, and was delighted when our hospital, along with Sutter Medical Center Sacramento, were both selected to be a part of this. Mills Peninsula was the other. So we had, of the 6 hospitals in California, 3 were Sutter facilities, which was pretty exciting for us. I was amazed at the support that we received, not only from the labor and delivery staff, but the doctors, their office staff, and administration, who all got behind us in implementing this and moving forward with this. Our figures were a little higher than what Dr. Gregg relayed. When we did a quick study trying to gather our statistics, we found that we had a 29% elective delivery rate before we started. And at the end of the first year of implementation, we dropped to 7%. And we are now averaging in 2012 to 13, 4%, and the last 3 months we've been at 0. So just amazing, amazing, amazing results. And the other piece I wanted to just share, those of us within Sutter all know that it's coming up time for our fundraiser. Our major fundraiser for the Sutter system is the March of Dimes. And we have the March for Babies coming up at the end of this month. And one of the statistics that was published was just pretty impressive to me. And on the flyer it says, since Sutter Health began its partnership with the March of Dimes in 1997, more than 640,000 Sutter Health babies have been born, and that Sutter Health has raised more than $6.2 million for the March of Dimes. So really quite impressive what we have done and then what we have been able to gather from the March of Dimes, and our successes in this program are just a piece of that. So thank you very much. Dr. Gilbert.
And finally, just to say a few things about with Sutter Health, all of our 24 delivering hospitals have taken on preventing elective delivery less than 39 weeks as one of their main objectives and goals. And in fact, the Joint Commission thinks this is so important. It's one of the required reporting measures starting in January for 2014. And I believe, isn't the Joint Commission at 5%? And right now, Sutter Medical Center and Sutter Roseville are well less than that. And so we're really proud of our efforts in working with the March of Dimes, in working with each other, and a fairly competitive nature to try to do the best that we can for our patients and so forth. I'd like to thank everybody for coming. And I think we have a little bit of cake and cookies back there. And I see somebody in the audience, Mary Campbell Bliss, who's worked longer and more with the March of Dimes than probably everybody here put together, except for two. But will you cut the cake, please? Anyway, thank you very much.